Lipedema community. Maja from Denmark is back again, and I would like to show you her result from the last operation. At first I would like to give you a kind of a back look to her medical history, because she has a very long medical history of weight gain, and then bariatric surgery, then weight loss, and then she had a lifting operation. And in this whole process, nobody ever talked about lipedema because nobody ever knew about that. But what happened after the lifting operation, and she had a lifting of the upper arms and a lifting of the thighs, what happened, and we see that quite often, is that at that point the lipedema fat started to grow rapidly. And so we got in contact, and we already did the arms. Maybe you remember the video from the last time from the arms. If not, I can show it to you again. And in the last operation, we did the front side of the thighs. Actually, at that point, we removed 7.4 liters out of the area, which went this way, up to here, and up to the knee area. So this is actually quite a lot of fat. And to support the skin retraction, we used BodyTite on the whole of the upper leg. And yeah, this is the result right now. Both of us are really happy with it. And today we do the front side. Maybe you turn around. The back side, sorry. You see there's a lot of lipedema fat on the back side. You see the difference between the treated front and the non-treated back. And this is what we do today. And in the next video we will show you how I do the markings. Hi again, so now I did the markings for the operation on the back side, and I can show it to you. This is the front side. You see what I did last time, and this is where all the lipedema fat is waiting. So this is the line, and if you turn to the side, we see this is the maximum point of fat. In this area with the green markings, you see the scar from the upper body lift. And it's very important not to remove the fat in this area, because in this area there's very little fat left. And turn around. And here we see the back side. I will remove everything here on the side. I remove the lipedema fat up to this line here. And what is important is to keep this area, not to touch this area, because you need stability in this area. If you remove all the fat here, the buttock will kind of drop down, you will get this really terrible banana roll, and you lose all the stability here. So it's very important, if you treat the buttocks, to respect anatomy and to respect areas where you should not touch anything. So this area has to stay. I can remove all the fat here. You see this is already done from the front side operation. Yep. And so we will start now. Hello dear Lipedema community, I've now finished with the operation of the backside of Maja, and I removed altogether 6.5 liters of fat. She has an actual body weight of 80 kilograms right now, so this is like the 8%, and I will give you a look on the result. So, what you see right now is of course quite a lot of excess skin in the saddleback area. Something interesting you can see, you remember I did the green marks here because the skin already folded in this area. After the operation you have more folding there, because this is an area, if you remove the fat, you have a bigger fold. What you see now is, this is the scar from the upper body lift you already had. I removed all of the fat here, so to give a good shape here, I removed the fat here. We took a little bit of fat out of the buttock area. And you remember I talked about this area where you should not remove the fat, and what is important, you have to keep the stability. If you look like this, you see the stability is still here. There is support for the buttock area, which is important. But of course there is excess skin, but what you see right now, that there is a small layer of healthy fat left. Same on the other side. So what we do right now, we close the stitches, we put her in the compression, and then this operation is finished.